Alright, so this is my sister Alyssa Solorzano. She was checked by Dr. K, the functional mobility assessment, and she just to make sure she was okay to do this. So she was certified by Dr. K. So I'm going to go ahead and start. So hi, Alyssa. My name is Levi. I'm a student physical therapist at Rocky Mountain University under the direction of Dr. K. So today we're going to be going through some interventions with you, some just kind of treatments and just kind of some strengthening, some stretching, some mobilization. Does that sound good to you?
Yeah, that sounds fine.
Okay, so to best do those mobilizations and stretching and that sort of thing, it's going to be best if I can put my hands in your low back, hip, and leg areas just to help get you in the right position, help guard you, make sure you're safe, and that sort of thing. Is that okay?
Yeah, that's fine.
Okay, great. So, first off, I kind of just want to talk a little bit about what is going on. So, with low back pain, it's very common to have low back pain, and we're going to treat it as best as we can. Anyways, we're going to work on how you walk, how your posture and everything, and just strengthening different muscles, that sort of thing. So, initially, we're going to start off with 3 times a week. We're going to go down to like 2 or 1 times a week, but we're going to start off initially for the first couple weeks with 3 times. In the meantime, I'm going to give you a home exercise program to do, but I'm going to make sure you're safe during it. So I'll tell you kind of how to do these safely at home. Okay? Sound great?
Mm-hmm.
Awesome. So what I'm going to have you do is if you go ahead and stand up for me.
Okay.
Okay. All right, and could you go ahead and bend forward and try to touch your toes? Okay. All right. How's that feel?
It feels okay.
Okay, so we're going to go ahead and get back up on this. Okay, and then I'm going to have you go ahead and put your head up there. So we're going to swing our legs around. Okay. All right, and this is, I'll perform manual traction on her just to see if she tolerates it as a mobilization. Dr. Wilkinson and Dr. K, I believe, said that we're not supposed to actually perform mobilizations at home, yet. So I'm not going to actually perform, but I would make sure I kind of stagger my stance a little bit, place my hands, and I'd make sure she's relaxed, but I would place my hands on her knees here or under here, and make sure I keep a strong core and just kind of shift back and forth to kind of provide that traction. That's going to separate the zygoplethysio joints just a little bit, and that'll hopefully create some relief for the patient. But anyways, okay, so say we performed that if I was in school, but now I'm going to go back into it. All right, Alyssa, so how'd that feel? Did it feel okay?
Yeah, that felt fine.
Okay, great. So I'm going to go ahead and have you sit back up here on the side. And go ahead and sit back up for me. All right, and come back over here. Okay, and could you go ahead and touch your toes again?
Mm-hmm.
Okay, great. All right, so that was just the assessing and reassessing joint motion. You can go ahead and sit back up.
Okay.
As far as dosage, I would do that the first time just maybe for a minute or 2, just to see how she tolerates it, see if it centralizes any pain. It does say she has pain shooting down her left leg, like some sciatic pain. If that centralizes in the low back, the traction may be a good option for the first few visits to decrease that and more centralize the pain. But then, if it doesn't, then obviously I would stop that. But if it does centralize the pain, ideally what I'd probably do is switch her to mechanical traction and do it for a longer time, probably like 10 minutes. And starting off with a low pull rate or pounds, and then progressively increasing depending on her tolerance. Okay, now I'm going to move on to some just active range of motion, or just movement. So, all right, Alyssa. So what I'm going to have you do now is actually you can go ahead and lie back down how you were. Okay. Okay. So what I'm going to have you do actually is I'm going to have you try to flatten your back out. So I don't want you to move your legs or anything, and I don't want you to move your upper body. I just really want your pelvis kind of rotating backwards, so your back has kind of this curvature to it. So I just want to kind of flatten it out. So you should if you like, you should kind of feel your back flat against the kind of curve your back slightly, and just make that flat against the back. So go ahead and perform that.
Okay.
Okay, back to normal. Okay, and push down a little again. Okay, so this shouldn't be like a hard push or anything. We just want you to kind of move it a little bit. Okay, so we're just gonna go and kind of like go back and come out, go back and come out. Okay, we're gonna do that 10 times. Okay, nice and slow, just gotta go in and go out, and go in and go out. Okay, so you can go ahead and relax. So I would perform that. That's just a posterior pelvic tilt that's being performed. I perform probably like 3 sets of 10. It's active range of motion, just to kind of get the back moving some. If she's tolerating it, I could do some more anterior pelvic tilt into posterior to get that whole pelvis going like in the fuller range of motion, and then see how that tolerates. If it centralizes her pain, great. If not, then I'd see if an anterior pelvic tilt would be more beneficial than a posterior. But for the fact of the matter, well, for this situation, we're just gonna say the posterior pelvic tilt was beneficial. Again, I think I said 3 sets of 10 for that. Not really holding, but just kind of going through the motion. So yeah, I guess that's it for the active range of motion that we're gonna do. Okay, so is that okay with you? Okay, so now next we're gonna go into kind of a strengthening exercise. So what I want you to do is I want you to find, you kind of have these hip pointers here in the front. Can you kind of find those? Like kind of right here. So I'm gonna have you move your kind of index finger, maybe your middle finger in just a smidge on the inside. What I'm gonna have you do is I'm gonna have you pull your belly button in towards your spine. So I don't want you to rotate, I don't want you to flatten your back really. I just want you to kind of pull that in, and you should feel kind of some muscle pushing back down here. It shouldn't be like you're gonna get punched. It shouldn't be like a huge brace everywhere. It should just kind of be a little bit of muscle right there. So we're gonna hold that about 6 seconds. Okay? And I just kind of want you to hold it, and you should still be able to breathe during this. It shouldn't be extremely difficult, and it shouldn't be like hard labored breathing. You should still be able to breathe fine. And we're gonna do that 10 times for 6 seconds. Okay? Alright, 6. Okay, great. So, and 10. Alright, so I think I said the dosage was 6 times, or hold for 6 seconds, which is a strengthening exercise. It's the transverse abdominis, trying to stabilize the core. I mean, that's kind of one of your major core muscles, and help stabilize the spine by strengthening that. The progression with that, if I were to progress that activity, would be to I could have her Kegel muscles activating, and then I could also eventually have her do a straight leg raise with it, or some marches, and just kind of get some large showing movement, and that would kind of be a progression of that exercise. So, yeah, I think we're done with strength. Did that all make sense to you? Do you have any questions about that?
Yeah, made sense. No questions.
All right, great. And with this, she really shouldn't have any pain doing this. It should just, like with the spine being stable, it should not cause really any issues. Also, I didn't necessarily do this, but I'm going to at least mention it. With the active range of motion, with her doing the posterior pelvic tilts, I'd more than likely have her do some, I'd have her do like lumbar flexion just to see, like assess and reassess. I did that for the mobilization, but I didn't get the patient up out of that since I already had her in that for the assess, reassess for active range of motion. So, okay, we're done with strengthening. So now we're going to move on, and I'm going to go ahead and have you sit up if you can. Okay, you can go ahead and swing your legs to the side here for me. Are you comfy sitting like that?
Yep.
Okay, great. So I'm going to go ahead and put this gait belt on you. I know you did this about 4 days ago. So I know you've been having some possible balance issues, but I would just like to put this on you just in case. We're going to do a little bit of movement, not a whole lot, shouldn't feel dangerous, but this is giving me something to grab onto to make sure I have good hold of you and that you're, as safe as possible.
Okay.
All right, so I'm just gonna, you can go ahead and relax. I'm just gonna put this around you. Okay. Okay. All right. It should feel snug. It shouldn't feel too tight, too crazy. Just like slightly snug. Okay. Does that feel okay?
Yeah, that's fine.
Okay, so I'm gonna go ahead and while you're sitting there comfy, I'm gonna go ahead and show you what we're gonna do.
Okay.
So we're gonna go and we're gonna stand here on the side of the table. Kind of use the table as some support if you need. We're just gonna kind of do some weight shifts side to side. Just to kind of we're gonna introduce some like little balance into this. So eventually, if you're feeling okay, what we're gonna do is we're gonna kind of lift one leg and we're gonna kind of get onto the single side leg swing.
Okay.
Sound good?
Yeah.
Alright, so go ahead. I'm gonna have you stand up for me. Okay, go ahead and turn around. Okay, go ahead and start shifting. Okay. Yep, just nice and easy. Okay, if you're feeling comfortable, you can go ahead and take your hands off. Okay, and you can put your hands back on, then go ahead and try to lift the leg. Okay. Alright, great. Okay, you can go ahead and get up. Okay, so I did some slight progression to that. It was an anticipatory. It was a static balance, anticipatory, static ground. And we were just on the firm ground there. So eventually, if we wanted to do more, I could add an Therex. I could add some perturbations on the side, or I could have the eyes closed if I wanted to challenge. Take out the visual system and challenge some of the other systems, like the vestibular system. But really, that's kind of working into the single leg balance. Just kind of reintroducing the single leg weight and get her kind of used to that. Was the whole idea of the weight shifts. I believe that is. Okay, so dosage for that, we would do that for. I'd probably set a timer for this if it were me. Just because it kind of lets them focus on just doing the exercise and not counting. But the whole idea of the 2 minutes would be, or maybe a minute to 2 minutes, depending on how they're tolerating. I'd probably do the 2 minutes because that would be about 10 to each side. So that would be kind of a proper dosage. And I'd probably do that like about 2 or 3 times. Probably 2 times for now to see how she tolerates it, but then progress to 3. Yeah, and then I believe that is all for the balance activity. So, all right, Alyssa, now we're gonna do kind of a functional activity. I know that this just happened a few days ago. What we want to see, I just kind of want to see how you're moving and how kind of the stuff that you are functionally doing in your daily life. So I have this here. I know that you said that you like to garden and that, in kind of the day-to-day we need to kind of pick something up. So I just kind of want to see, this functional activity is kind of like reaching down and picking this up. This is very lightweight, if you can feel that. It weighs next to nothing. It's just cloth, I guess, whatever this is. Anyways, so we're just gonna kind of, if you can tolerate it, I'm gonna have you go and lift down and reach, kind of bend at your knees, kind of keep that core stabilized, and kind of grab this and go up. We don't actually need to grab this, but we're just gonna kind of practice the functional. We're gonna have that there in case you're okay, but we might not get to that today all the way down. So we're just gonna kind of do a little bit of that functional movement that you would do if things were a little bit better.
Okay. Yeah.
Okay. So I'm gonna go ahead and have you stand up. Okay. Can you face that way for me?
Yeah.
Okay. So I'm gonna have you make sure you're keeping your core strong and kind of keep that belly button in, keep that muscle engaged. And we're gonna go ahead and try to bend down, and I'm gonna put this here. And you go and bend down, and it's okay if you don't pick it up. Okay, come back up. Okay, so we're gonna just do that a few times. Okay, back up. Alright, and you can go ahead and sit back on the table.
Okay.
And how does that feel?
Okay.
Feel okay?
Yep.
Alright, great. So this is probably, for this patient being 4 days out, this might be a little ambitious to do this functional level, like this functional activity. Ideally, functional activities would be later on in the rehab process, but that is something functional that I would do, especially with the patient that likes to garden. Bending down, picking something up, bending down and grabbing some weeds or anything like that, reaching towards the ground is a very functional activity. So ideally I would do that later on. Probably on day 4, I'm probably not going to do a functional activity, but that is something that I would possibly do. Anyways, so doing that, I would probably like quite a few repetitions. If I don't have weight and I'm just practicing the activity and just kind of how to do the movement, I would try to do more of that activity. So I'd probably do like 3 sets of 15 or 4 sets of 15 or something like that, just to get the higher reps and just kind of get that muscle memory, I guess, of doing that motion. But anyways, at that, if we were to add weight or something to actually practice like lifting something up strong, then I would, depending on what I would want to do, if I was looking for more strength, I might only do like 5, like 2 or 3, like 3 sets of 5 or something like that. But yeah, that's if I'm using more weight and trying to actually gain lots of strength. And then, yeah, okay. So I believe that is it for this practical. So thank you for watching.